My name is Julie Thorne, and I am a nurse practitioner at the Beauty Barn. We're going to be going over a laser procedure today, the BBL and Moxie procedure. The BBL stands for broadband light, and that procedure is done to target pigments and rosacea and reds in the skin. It is one of our most popular procedures, and our patients absolutely love the results. The Moxie laser is a non-ablative resurfacing laser, and it is intended to do tone, texture, and some light brown pigments as well. The first step in doing this procedure is to get the patient prepared. So this process takes about 30 minutes, and it involves really great before photos so that you can see your results, a Visius scan, which is one of our advanced photography systems that gives us an analysis of your skin in a 360 mode. We also do apply some numbing cream. So the numbing cream is just to make the procedure a little bit more comfortable. It's not particularly painful, but it is something that just helps your comfort level during the procedure, and that stays on for about 20 minutes prior to starting. Once we're ready to begin, we clean off the face and we get that nice and clean, all the numbing cream off, and we apply an ultrasound gel. The ultrasound gel is for the BBL procedure, and it allows the light to be conducted in the most efficient and safest manner. The BBL stands for broadband light. We utilize different filters to target different areas. So we select the filter based on the patient's skin type and their top concerns. So if it's rosacea or pigments, we're able to target and select what filter to use. It's almost like having a 6-in-1 laser because we're able to utilize different filters to target different concerns. The top concerns that we see treatment with the BBL is acne, rosacea, which is redness, flushing, areas like that, and brown pigments. So those can be aging spots, they can be pigmented spots on the face that have even been there, even freckles. That is usually what we see coming in for the BBL procedure. Once the patient is all set with, they've had their numbing cream on, we've cleaned them off, we apply the ultrasound jelly, now we're ready to actually apply the laser. The laser is very bright. The light is very bright. We utilize protective goggles for anyone that's in the room. So the patient wears protective goggles as well as the provider, and we're able to utilize the broadband light to treat the surface area of the skin. The first couple of passes are called base passes. They actually can reduce some of the wrinkles and can help with skin tightening when done over time. Those base passes are done, they're not particularly painful, and they just produce a healthy energy into the skin. Once we're done with the base passes, we then change some of the settings on the machine to target any red. So if the person has rosacea or redness, we're able to change out those filters to target those red areas. Additional things we can target in that same setting is facial vessels, so little broken capillaries around the nose or anywhere really on the face that are either visible or something that we may have to look at through a magnifying glass. Once we target facial vessels, we are also able to target cherry angiomas, which are the little red dots that you sometimes see on your face, neck, chest, or the rest of your body. Once we're done treating reds, we then go on to treating the brown pigments. Again, this is a different filter, so it's like switching out the handpiece on the laser. So this can be done treating all over or just spot treating certain areas that might concern the patient. Now, once we're done with the BBL, that sometimes is all the patient does. We're able to clean their face off, and that is the only treatment we do for that day. Depending on the amount of damage that's done to the skin, sometimes that's the only laser that we can do on a patient in a single setting. However, most people choose to do a combination treatment. The combination treatment is the BBL combined with the Cyton's Moxie laser. The Moxie is a non-ablative resurfacing laser. It utilizes laser light on a clean, dry face to target pigments, light pigments, texture, and tone. So what this laser does is it allows the skin to become incredibly smooth. And as soon as one treatment, you can start seeing results. The Moxie is a very popular laser. It does not have a lot of downtime because it's not ablative. So people who see a lot of, posts and things like that with very, very severely looking bloody skin, that is not what this laser is. You do turn pretty red after that redness lasts for 24 to 48 hours. We get a lot of questions asked by our clients about what the downtime after these procedures are. And you can safely say you're going to be pink to red for 24 to 48 hours. And you might be a little puffy puffy or swollen on the under eyes or around the tops of your eyelids for about 3 days. So don't plan on having any major, life-changing events in the 3 to 5 days after your laser, but you can absolutely go to work. You can wear makeup the next day. We do recommend certain products following the procedure. It's a post-procedure system that we like for you to use that has a post-procedure approved facial cleanser, hydrator, moisturizer, and post-recovery repair complex. And that just gives you the fastest time for recovery. And we do recommend that for all of our laser patients post-procedure. What you can expect after is for the reds to turn a little bit more red and the browns to be a little bit more brown. The Sciton, Moxie, and BBL treatments are something that most anyone can benefit from. We would love to see you in for a free consultation and to see if this treatment is right for you.